families. Mother's Day has a special place in my heart, of course, because of the sacrifices made by my own mother over the years to her children, the inspiration she gave to my sister and me to be the best people. And Alice Georges, mother of Congresswoman Anna Eshoo. There you are. Elsie Frank, mother of Congressman Barney Frank. Sam Gadenson. Mother of Congresswoman Cynthia McKinney. Vela Holmes, mother of Congresswoman Eleanor Holmes Norton. Mae Scott, mother of Congressman Bobby Scott. Donna Loveland, mother of Congresswoman Karen Thurman. Now, let me also acknowledge some other members of Congress who are here. I'd like to ask all of you to stand and then be Carr and his wife Kate Carr. Let me see now. Congressman Bob Filner and his wife Jane Merrill Filner. Hold on now. Congressman Sandy Levin and his daughter Madeline. Congressman Pat Williams and his daughter Erin, and Congressman Robert Underwood and his wife Lorraine. Thank you all for being here. And Congressman Jim Bilbrey is here also. Jim, do you have your... And Mrs. Bilbrey. And I'm sure I probably left... Congressman Donald Payne is here. Thank you. Anyone else? Professional volunteer schedule with the demands of our family. She is unbelievable, and among other things is the glue that holds our precious family together. She has always recognized the importance of preserving and protecting our cherished family life against all the demands of career and schedule and the mother of our 4 children, Tipper Gore.
Thank you. Thank you all. Thank you. Appropriate that we would have this kind of celebration today for Mother's Day. And I also want to say that I know all of us will keep a special place in our hearts for the President's mother, and it's going to be a difficult Mother's Day for him this year. But mothers especially have traditionally been the ones to agonize over health care. And I'm proud to be a part of this administration who covered in the past year and a half, working on behalf of the administration's health care reform efforts, is that not only is it women and mothers' concerns, but it is the nation's concern that we have health care reform. And I feel very deeply when people write to me who do not have this coverage, who are worried about how they're going to care and take care of, care for and pay the bills for their sick children or elderly relatives. And I will say affects 1 in 4 American families. And under his proposal, all Americans, including mothers of children, wives of husbands, and daughters of parents with mental...
Thank you. Thank you so much, Tipper, and thank you for your leadership for us to have here at the White House as we do look forward to celebrating Mother's Day. In addition to the members of Congress and their mothers and children and improving the lives of Americans in general, and I want to thank all of you for being here as well. Everyone in our country has a big personal stake in health care reform, but I do think it is fair to say that women, and particularly mothers, have the biggest stake. It usually is the mother ongoing care. Eve's mother has lung cancer and needs help bathing and dressing and walking. Her father has mental disabilities. She didn't want to put them in a nursing home, so she moved them from their home in New York to her home in Pennsylvania, prevents them from taking care of their own family members. The same thing happens on the other end of life at the very beginning. Many of you know who are born with serious chronic conditions, mothers who want to be there to care for their children after life-threatening and debilitating accidents. That's one of the things that Al and Tipper talked to us about on those early bus trips, what it was like when Albert was in the hospital all those days. They did have the Bobby and Judy are here with us, and I'd like our two young mothers. Two young mothers who
Can I close that down now? It's time for me to speak? Yep. Thank you, Mrs. Clinton. It has been a long time since I last visited the White House, more than 30 years. My husband, John, who was Democratic National Chairman, my daughter, Barbara, to Kennelly, and my great-granddaughter with her. I am here today with my face, President Clinton.
Wow.
Wonderful. Just wonderful. Great. Very wonderful.
The mothers who are here for doing such a good job with their sons and daughters, helping them to achieve a full measure of So I watched all the people along the way being too intimidated to say no, they wouldn't vote for me. And sure enough, we carried it. But on Mother's Day, we tend to think that we face up to our responsibilities. Very often the values, the internal character structure of children is profoundly influenced by the sort of daily insistence of mothers that you just face up to your daily tasks and do your job, and life will take care of itself. And that may seem terribly elemental, but one of it was to a very common sense, old-fashioned American judgment that it was the right thing to do, the disciplined thing to do. Sort of thing your mother would be proud of you if you did. I say that because, my mother used to tell me all the time, said, Bill, you give a good speech, but you still have to do something. How the system fails families today. She said she was a self-employed writer, and her husband had a hard time finding health insurance. And when they finally found insurance that they were actually able to purchase, the quarterly payment was $1,800. That's $7,200 a year for a family policy. And still, after they paid all that money, their worries weren't over. She and her husband moved from New York to Rhode Island, and she knew that common sense tells you that if we can make it possible for it and assume their responsibility too. We have got to try to reform this system to try to help people stay healthy and take care of them when they're sick. In any given year, about 1/3 of all, and there are an enormous number of women who now have the HIV virus and who have passed it along to their children, or some have it and some don't. And we don't know whether or not there are different. For one thing, I put only women in charge of the health care struggle. We created an Office of Research on Women's Health at the National Institute of Health and increased funding for breast cancer research, for a national action plan on breast cancer, for research into other